Yes, I think we should start. So I'm just going to ask the anchor person, Dr. Dada, so please get the whole thing started. Thank you.
Good morning, distinguished ladies and gentlemen. We are glad to have everyone join us this morning, and we have with us an alumna of the Premier University, the University of Ibadan, someone that is known to us as a product of Ibadan to the world. Dr. Yetunde Dairo is going to be speaking on a topic that is, for me, new in the world of physiotherapy, and I'm glad to be a part of this. She's going to talk on co-creation methodology. But before she gives a lecture or a presentation, I will invite Mrs. Cindy Samuel Dofia to read a citation.
Thank you very much, Dr. Dada. Good morning, everybody. I will be reading the citation of the guest lecturer, Dr. Yetunde Dairo. Dr. Yetunde Dairo is an associate professor of physiotherapy at Buckinghamshire New University and head of the Physical Therapy Research Group. She was previously interim deputy head of school for the School of Health and Social Care and the cluster lead for allied health professions and advanced clinical practice. As part of the school leadership team, Dr. Dairo has experience in managing physiotherapy, physician associates, and social work teams. She has successfully led and supervised the teams to ensure the delivery of high-quality education and the achievement of organizational objectives. With a rich academic history, Dr. Dairo earned her PhD from Oxford Brookes University in 2017, focusing on physical activity. This achievement was preceded by a master's degree in rehabilitation science from Southampton University in 2005 and a bachelor's degree in physiotherapy from the University of Ibadan in 1994. Her academic journey is complemented by her development of MSc and BSc physiotherapy pre-registration programs at universities in the UK and abroad. Dr. Dairo's professional journey in the UK spans 17 years within the NHS as a clinical specialist neurophysiotherapist and the complex health and physical disability lead at Southern Health Foundation Trust. Her transition to academia began as a part-time senior lecturer at London South Bank University in 2008, focusing on neurosciences. She returned to clinical practice between 2011 and 2014 before enrolling in a full-time PhD program. After completing her PhD in 2017, she served as the program director for physiotherapy at St. Mary's University and later as an assistant professor at Coventry University until September 2020. In addition to her leadership role at BNU, Dr. Dairo teaches postgraduate courses on research and evidence-based practice in healthcare, emphasizing collaborative practice through co-creation. Her research interests include physical activity among individuals with intellectual disabilities, neurological impairments, and socially disadvantaged groups. She collaborates with physiotherapy academics, students, and stakeholders to promote more inclusive research and practices, and is a passionate advocate for diversity and inclusion. In addition to her academic achievements, she's a Health and Care Professions Council partner and was appointed as lead visitor and chair of the HCPC approval panel in 2023, demonstrating her commitment to upholding the highest professional standards and adhering to the regulatory requirements set by the HCPC. She's also a HEA, Higher Education Academy Senior Fellow, recognizing her expertise in teaching and learning in higher education. This designation signifies a commitment to promoting excellent teaching practices and supporting the professional development of fellow educators. She is a member of the Chartered Society of Physiotherapists. Additionally, she was appointed as a member of the NIHR Funding Committee for Predoctoral Fellowship in January 2024. Dr. Dairo has experience in supervising PhDs and mentoring doctoral students in their research and academic pursuits, helping them to grow and develop. Her current research includes co-creation methodology, improving collaborative practice through co-creation, and studying physical activity in special populations, such as those with long-term COVID-19, stroke patients, and those with neurological impairments. Dr. Dairo's international experience includes work in Nigeria, the Republic of Seychelles, and in the last 25 years in the UK, enhancing her expertise and leadership skills. Her current research portfolio encompasses co-creation methodology, improving collaborative practice, and addressing physical activity in physical populations, including those with long COVID and general neurological impairments. Her commitment to inclusive education is evident in her work adopted by the NHS England, now available on the NHS Learning Hub, to support educators in supervising without prejudice. With extensive experience in clinical and educational settings, Dr. Dairo continues to mentor doctoral students, fostering their development and contributing to the advancement of physiotherapy and inclusive practices. Her global perspective and dedication to her field make her an asset to the physiotherapy community. Thank you. Back to you, Dr. Dada.
Dr. Dairo, you have the floor now.
Good morning, everyone, and thank you very much for having me. I'm delighted to be back in UI, and it would have been nicer if it was in person, as I said, for those of you that joined earlier, but I'm sure that will happen in due course. I'd like to especially welcome you all, and looking at the participant list, I'm delighted that my mom is on the call as well. So special welcome to my mom that she's come to join this call this morning. So I hope that this will be interactive, and my slide is not too many. I don't like to use too many slides in any presentation. Some of it I might just even skip over because I want to hear from everyone on the floor this morning. So what I will start to share my screen, but from time to time, I might alternate between sharing and just kind of coming back to people to ask questions and to hear from you. If you want to participate or answer any of the question, just signify by raising your hand, and I'll leave that to Professor Odole to choose which other people take turn to speak. But please be prepared to talk. I want to hear from as many people as possible. And so thank you once again, and I will just share my screen in a little while. So I will be talking about co-creation methodology, its application in education and health. And, thank you for the wonderful introduction that was given earlier on. For those who may have missed that, my name is, I'm Dr. Yetunde Dairo, and I'm an associate professor of physiotherapy. So why is co-creation important? There are lots and lots of studies that have been done in literature to look at why co-creation is important. And so this is just a summary of why we do co-creation. There are attainment disparities and exclusion in education. Obviously, depending on where you practice, those issues might be different. In the UK, where I've worked in the last 25 years, there is attainment disparity, and one of the principal factors for the attainment disparity is race. The second is people's background. So depending on your race and the kind of background you have, it does ultimately impact on your degree outcome. So for example, in the UK, students from Black, Asian, and minority ethnic background, they don't do as well as their counterparts when you look at their degree classification. If the assessment is blinded, race doesn't matter. But in observable assessment, race become a factor, and people's background. So people from more affluent areas, they tend to do better than from places of high social deprivation. But there is no reason for that, because people need to be judged based on their ability, not on what they sound or look like. That is the attainment disparities in the UK, for example. But in places where race is not an issue, there are other things like people's background. There are research to suggest even that your family educational background, whether you're the first to go to university in your family or whether you come from a family of professors, affects your attainment. And so one of the ways to bridge that is through co-creation, so that people can achieve as well as others, irrespective of whether they're the first to go to university in their family, whether they're from an affluent background, and what they look or sound like. So if you are interested in inclusion, and if you're interested in people achieving the same, regardless of what they sound, speak, or what their background is, then co-creation, it's the way forward. In terms of health, there are health inequities and marginalization all over the world. So people don't have the same kind of access to healthcare. Again, similar sort of situation. So if you're from an affluent area and you're highly educated, or you have a lot of wealth, your health outcome is better and you're heard more. If the reverse, if you're from a poorer background, you're poorly educated, or you live in a deprived area, you tend to be marginalized. People don't see you and they don't hear your voice. Again, if you're interested in developing health care for all, irrespective of where they live, what they sound like, what certificates they have, what prefix goes before or after their name, then co-creation, it's a way forward. And that's because co-creation ensures relevance and efficacy. So if you want to, in your line of work, whether it's in education or in health, co-creating resources, material, or co-producing things with relevant stakeholder ensures that there is your end product is relevant and the process itself is efficient. So the purpose of today is to outline co-creation methodology. So at the end of this session, I hope that everyone will go away from here with a better understanding of what it means to co-create. Explore application in education and health. As I said earlier on, looking at our audience is applicable for education and is applicable for health. In fact, it's applicable for all spheres of life. However, looking at making this appropriate to the audience, focusing on education and health. And like everything, it has its own drawbacks. So we're going to discuss some of the potentialities and challenges. So I'm going to stop sharing my screen in a while so I can see the audience. I want you to tell me what co-creation means to you. So what does co-creation mean to you?
Dr. Dairo, would you want them to type or would you want them to speak?
Speak, yeah, so they should,
please.
Yeah, I want to hear from people.
Okay, that's fine. So if anybody wants to speak, can you just have your virtual hand raised?
Okay, someone said they're in another meeting, they can't talk. Yeah, let's hear from those who can talk. I want to engage everyone.
Okay, I have two hands here. Can Abib Olatunde Ogushola and then thereafter Dr. Laleye, just unmute yourself and speak.
Okay. Good morning, everyone.
Good morning.
Good morning, everyone.
Good morning, we can hear you.
Okay, from my own understanding of co-creation actually is an approach that involves organization, institutions, involving end users of service to actually improve their product and service by involving them in their design and then development, so as to optimize their service. So that's just my own background understanding of co-creation.
Okay, thank you. So co-creation from an organizational perspective. Thank you.
Dr. Laleye, please.
Yeah, thank you very much. For me, I think co-creation in terms of research has to do with participatory research. You are bringing in the people for which you want the findings, you want to apply your findings in from the beginning, that you are trying to capture the voice of your participants in the whole process of your research. So it's more or less like participatory research between the researcher and the participants or the people for which you want your outcome to be applicable. Thank you.
Yeah, thank you very much. So that's really interesting because the first speaker, I spoke about it from an organizational perspective. And we've just heard from Dr. Laleye about looking at it from a research point, which is more at an individual level and involving stakeholders. And all of those are right, so co-creation involves organization and it also involves people. So let's hear from others who are on the call.
Okay, the last person now, Dr. Adeniji, I hope. Adeniji.
Thank you. I would say that co-creation is simply making sure that an idea or an objective is achieved by making sure that everybody's opinion is being heard into that objective. So that's my definition of it.
Yeah, thank you. Wow, some excellent contribution from everyone. I'm glad that this is recorded.
Yes. There was some understanding in the chat group. I don't know if you don't mind. Let me quickly read them out.
Please do. Please
yes,
do.
We have from Professor Oluwashola. It's about collaborative innovation, bringing many ideas together to achieve a purpose. From Dr. Yetunde, co-creation involves end users in a design and all phases of study. Professor Oluwashola also added that in addition to what he already had before, co-creation makes the participants have a say in the design of the research, and that is all we have on the charts. Thank you.
Yeah, thank you. Yeah, all very relevant, all very thoughtful and engaging and excellent responses. Thank you, everyone. So I'm really, really delighted that we've kind of, even in this short sort of discussion, people have talked about co-creation from different angles. So you've looked at it from an organizational perspective, you've looked at it from research, you've looked at it from working collaboratively. I think one of the responders, one of the word they use that I like is about making sure that everyone is heard. And I think that is one of the key pillars when it comes to co-creation. But before I go on, carry on with my slide and sharing with you my very brief definition of co-creation. How is this different to like just, interviewing people? So you've said about, making sure that every voice is heard. Someone said, I think it was Dr. Laleye that said it's a form of participatory research. Absolutely nail on. There are all kinds of participatory method for engaging people in research, and co-creation is one of them. But it's more than that because, as I said earlier on, you can do co-creation in and out of education. You can do it in health. You can do it in everyday work, anything that involves you creating something for others. You can use co-creation. And although my talk is centered around health and education, but is much more broader than that. And within that, you can throw research into the mix, but it's beyond that. So I just want to kind of make people think. So when you say co-creation, and we've kind of discussed that it can be at a personal level, it can be at an organizational level, involves getting everybody's voices heard, and there is a lot of evidence for it in literature. My question is, how is that different to just kind of interviewing people? Again, people can, if you want to answer that, please signify by raising your hand.
Okay, Sule. Can we kindly?
Yeah. Hello. Yeah. Yeah. I think it's different from interviewing people because everyone is everyone has a stake in it. There's shared ownership, and there's open communication, and people are involved in the decisions. So it's
Yeah.
empowering stakeholders to contribute ideas.
Yeah.
Thank you.
Thank you. That's an excellent contribution and really nice to hear from you. Biola. Biola and I were in UI together. She was the year below me. So I'm really delighted that she could join this call. Yes, absolutely. I like those words, stakeholder has a stake, because quite often when you are interviewing people, there is an agenda. You want to hear from people. In co-creation, you also want to hear from people, but they have a stake in that. So they're not just there to fulfill your desire. They're not there to meet your aims. You're all there together for a collective aim. So where we bear that in mind is really, really important because I think that determines whether co-creation is successful or not. Is that key element of recognizing that everyone in co-creation has a stake. And there are no experts actually in co-creation, as I will discuss as I go back to my presentation. So I'm going to go back to sharing my screen, but please feel free to put your thoughts and opinion in the chat, and there will be another interactive session in a short while. I need to make sure that no one is falling asleep here. So this is a very brief definition of what co-creation is, and it's not meant to box in what co-creation is, but actually just to give us a focus. So co-creation actively involves end users in the development process, ensuring relevance and efficacy of resources of product. And I think this is really key, because quite often, either as academic or healthcare profession or anywhere you find yourself in any areas of life, we see ourselves as experts who dishes out ideas to others. When you think about co-creation, you have to step down from your expert role, because you're involving everyone. And as Biola contributed earlier, it's about everyone having um, a stakeholder, a stake in what you're doing and in the end product. And so there are different methods of doing this. When you look in literature, my preferred one is the design thinking approach, which involve initial scoping with stakeholders and organizing collaborative workshop and iterative refinement and testing. And I have a case studies that I will use to explain all of this term. So when you run workshops, these are just some key principles to think about to make your workshop successful. You need to define the key issues collaboratively. So again, it isn't a case of an expert telling people this is how to do things. As an expert, you can set the scene, you can define the aims, but once you go beyond the aims, everyone needs to be involved. You need to also refer to previous research, or in cases of where you've interviewed potential stakeholders, and you need to incorporate that into your workshop. And then you need to be prepared to develop prototypes and test them. So one of the key things in co-creation is, you look at different ideas and test them. So it isn't a case of one size fits all. You need to be prepared to look at different ways of looking at the same question that you're asking. And you need to prioritize inclusivity and safety, particularly because there are power imbalance. If you're a consultant, for example, and you're running an intervention session that you want to co-create with your clients or patients, you're the expert. They look up to you for answers, and they believe, rightly so, that you know a lot. So already there is a power imbalance. So the onus is on you to ensure that you're prioritizing inclusivity and people feel safe to air their view, and there is no judgment passed. As I said earlier on, when you're doing co-creation, you have to step down from your role as experts and listen to others. So this is an example of a work that I was involved in which we co-created a resource, and the approach we used was a design thinking methodology. And how we achieved that was that we delivered 5 online workshops and 1 face-to-face session. The number of workshops you deliver when you're doing co-creation can vary depending on what it is that you're co-creating. For this example that I'm giving you, we were co-creating an inclusivity resource to help educators supervise without prejudice. And so the participants that were involved in that particular work were 5 physiotherapy students, because the initial research that informed that particular co-creation work stemmed from attainment disparity in physiotherapy education in the UK. So a group of us looked at the data for UK education, and we found that those from white background, they were doing better than those from other backgrounds. And those that were living in more affluent area, they were doing better than those from poorer background. But what was even more interesting was that when you dig into the data that we collected, if the assessment is not if the assessment is not seen, so for example, if it's a written work where students just use their numbers, there is no difference in attainment. The difference in attainment starts to creep in when the assessors can see who they're assessing. So that suggests there's an element of bias, isn't it? And so we put together a resources to help people supervise without bias, so that they can supervise people regardless of what they look or sound like, and the outcome will still be the same. And then we included 5 practice educators because these were the key stakeholders. The student, they were on the receiving end. They're on the receiving end because they're being trained and they're being graded. And the educators, they're the one delivering the training. So these were the key stakeholders we identified. And then 4 project team members who were university academics, and I was one of them. There were 2 other professors from other HEIs in the UK and another senior lecturer. And so the focus was on brainstorming, empathy mapping, problem definition, prototyping, and testing. And I have a diagram which summarizes all of this nicely. I apologize, it's a very busy diagram, but it's a very complex sort of phenomenon. Initially, when people think about co-creation, they always think it is simple. And yes, you're right, it is simple, but it's equally complex because you need to get all of the moving parts right, which is why this diagram looks the way it does. So as I said, this is an exemplar that I'm sharing from a work we did. So we co-created an inclusivity research, and this is how we did it. So we ran 6 workshops, as I said in my presentation. 5 were online and 1 was face-to-face. And so the first workshop was an introductory workshop where we looked at the aim of the project. And you need to get this right, because when you're co-creating, people need to feel confident. People need to feel that they can use their voice and they will be heard and they will be listened to and they will not be judged. And nobody's voice is bigger than the other. So if, for example, in an educational setting, which this was, on that team, there were 3 of us, either associate professors or professors. And then you have students who have just enrolled on a physiotherapy program. But actually, despite our years of experience, our voice doesn't matter more than that physiotherapy student. So the first thing you have to establish for a successful co-creation is parity. How you do that might be different depending on the work that you're working on. For this particular project, it was by establishing that everyone's view matters. And your view as a professor doesn't carry more weight than a first-year student when it comes to co-creation. In other things, it might do, and rightly so. But when it comes to co-creation, parity is critical. And then the next thing is about empathize and define. So you need to be able to empathize with the thing you're engaging in. If you're using this in the context of health, if, for example, you want to do like you run a pain clinic and you want to run an exercise session, for example, for people with low back pain, it is likely that you yourself have never experienced low back pain. However, those people that you're co-creating the exercise program for, majority of them would have experienced back pain. Some of them might be carers for somebody who have experienced back pain. Some of them might be professionals who are supporting those who are delivering an intervention with low back pain. everyone in the co-creation group have to be able to empathize. So if, for example, you're there in your capacity as a clinician, you need to be able to empathize with those people who are going through the condition, i.e., who has a low back pain. And if you are there as a patient who has a low back pain, you need to be able to empathize with people who are actually putting the resources together for you. A nice way of putting it is putting yourself in other people's shoes. And you do that for everyone. So people put themselves in your shoes. Likewise, you put yourself in others' shoes. So you start by making sure there's parity, and then you go on to empathize and define. And if you don't empathize, it's actually quite difficult to define, because without that empathize stage, that is when people tend to think their own sort of thinking is superior. But if you can get over that and you can empathize, then the define is very easy. And you start to think about the definition right from the empathizing stage, which is your stage 2. And then you go on to defining. In this case, we define what the issues are. So we had carried out a series of interviews with physiotherapy students who were non-white and studying in the UK, and they've given us their testimony. And so from that testimony, we started to define what the issues were. And then we moved on to ideation. And this is very critical because, you know, when you look in literature, for those of you who are academics or even clinicians who is interested in the concept of co-creation, and you look at Brown and this, the Brown method, it is presented as a linear phenomenon, but it isn't linear at all. So it isn't a case of moving from defining to ideation. You might need to go back. So in your ideation stage is when you start to ask yourself, how might we answer the problem? How might we answer the questions that have been identified? And sometimes that might necessitate you going back to defining what the problem is, which is what happened in the exemplar that I'm sharing with you. And then you move on to prototype. Your prototyping is when you are agreeing what to do. So we started by identifying aim, and we went on to empathizing and defining what exactly we want to answer. And then we went on and further refined, and we brainstorm on how might we resolve this issue. And we came up with a prototype. So this is how we're going to do it. In our case, in the exemplar that I'm sharing with you, we designed a technology enhanced research, which is currently hosted on NHS Learning Hub. So the work that we define from this project has been adopted by NHS England. And even if you're interested, you can take the training because it's available to all. And so, but it was very critical that it wasn't just a group of professors or associate professors sat behind their keyboard and churning out lots and lots of ideas. It was something that involved all the relevant key holders. Most co-creation work would involve an evaluation. So you try out what it is that you've developed. So if you say that this is something I'm proposing to answer a question, you try it out. And the results, we had something, the principle that we used was inclusive, collaborative, and open dialogue. The outcome, the training results reflect real challenges faced by racially minoritized students. Depending on what the issue it is that you're looking at, yours might be different. But there are challenges that you need to be aware of when you're thinking about co-creation. One of them is time constraint and balancing roles, like I said earlier on. But resource remains, resources are unlimited. And the time that a professor has to do co-creation might be different to that a student has. And so those are the things that we reflected on in the work that we did. And so it is essential to do co-creation. The process of collaboration is influenced by resources, and it has potential for lasting influence. And so this slide, apologize, is another busy slide, but I wanted to get everything in as a reference point for principles of good practice. If you just focus your on the left side of the screen, this is a summary of the agreed principles that we have found that make co-creation work. It needs to be inclusive, which is what I've emphasized throughout this presentation. It's collaborative, so you work with everyone. It is supportive, you're there to support each other, and you need to acknowledge if there are power differentials and how to address that. And more importantly, it is a safe process. And this kind of cyclical diagram just kind of explain all of these in practice. So interactive stakeholder mapping. So I'm going to stop sharing again. Who do you need to be in co-creation? So over to you. So we've talked about the methodology, we've looked at the principles, I've shared an example. I just want to now say, who do you need in co-creation? I want to hear from everyone. Who do you need? Some of it have said already. I just want to make sure that everyone is engaged in this. Who do you need in co-creation? Yes, Dr. Dada.
So excuse me, the end user.
End user. Who might those be? So what does that? Yeah.
For example, for the example you cited, the minority students or students who are monitorized. So they are the affected people. So
okay, so students could be one of the stakeholders. Who else? Anyone else? So your student could be your end user. Yes, Akinwola Oluwasegun.
Good morning, Ma.
Good morning.
So, I believe the policymakers can also be stakeholders.
Yep, absolutely. Yeah, spot on. Yeah, you can have policy makers, you can have students. Yeah, yes. Can you? Yeah, I want to hear more from everyone. Someone put in the chat, those to whom the research is to serve benefits. So if it's within the context of research, who is your research going to affect? Your patient, the carers, the family, other healthcare professionals, all of those are potential stakeholders. So again, someone has just repeated that in the chat, clients and patients. Thank you. Anyone else? Anyone else that you'll be? Yeah. And it's interesting to think about it because, when we think about co-creation, we often think about others and we don't often relate it to ourselves because actually you are a co-creator yourself, isn't it? You are part of the stakeholder. Otherwise, you won't be doing it. Whether you're doing it for health reasons or you're doing it for educational reasons and even staff, so you could have a team of people working with you and you want to work in certain way and you want to co-create the new way of working with them. All of those are stakeholders. So the short answer is everyone can be a stakeholder, including you and me, everyone, depending on what it is that you're working on. Because otherwise, then you won't be reaching the right people. So the way to start it is to have an open mind, to have an openness, and to so being a co-creator can be anybody, and in fact is for everybody. So I'm just going to go back to my slide, and like everything else, there are challenges. So it isn't always plain sailing when it comes to co-creation. So here are some of the challenges that I've put together, both from personal experience and from research. So balancing perspective. So if you're a professor and you're co-creating an educational material with your student, your perspective may be different. Your student may just want to pass. That's all they want to do. Whereas you as the professor, you might be looking at method of engagement. Overcoming power differentials is easier said than done. If somebody view you as extremely knowledgeable, that can be a barrier. What can we do? We need to ensure representation, and we need to manage expertise difference. So I'm coming back to you again. Has anyone experienced barriers in their co-creation? So I'm going to stop sharing and see whether, so I'm back to you. Has anyone done any piece of work and they've experienced challenges in their co-creation? Yes, Professor Dolly?
Thank you. Thank you. Whilst you were asking that question, something just came to my mind. And that was when I had to develop a tool for the management of osteoarthritis several years ago. One thing that I've observed that could be a barrier or a challenge in co-creation in our context here is this paradigm that we have in terms of healthcare provider centeredness, where we see the physicians, the healthcare professionals as God. So the patients themselves, they feel a little bit intimidated. They are not empowered to see themselves as partners. As partners, when you were talking about this issue of overcoming power differentials, in a case where the physician or the healthcare professional already knows that we do not have any, that we should encourage inclusivity, we should have collaboration. But meanwhile, the patients, on the other hand, actually see you as the yes-saying person. You are the one that has the final say. So they're a little bit not too, they do not exactly want to express themselves the way they should be based on this, your presentation on co-creation methodology. Thank you.
Yeah, thank you very much. Absolutely. And, and I think if there's anything you take away from this morning, when it comes to co-creation, is that all voices are equal. But that doesn't mean that everyone puts in the same effort. So one of the things that you need to bear in mind is that just because you're doing, you have a broader shoulder and you're carrying the heavier load doesn't make your voice any more potent or more powerful than others. So there will be people who are working more when you're co-creating things. Like in the exemplar that I shared with you, the four of us who were academics, I think we put in 5 times the work of the students and the clinicians. So in that resource that we co-created, there were 14 of us that co-created the resources, and 4 of us were doing much more. So for every 1 hour the student co-creator put in, I put in 5 hours. The other professors put in 5 hours each. But that's the reality of co-creation. And it's important for you to identify that right from the outset. You need to identify those with the broader shoulder, but the breadth of your shoulder is not correlated to the power of your voice. So every voice is equal, but some people carry heavier loads than others when it comes to co-creation, because otherwise the work just won't be done. And so I just have one more slide to share with you. I have other slide within my presentation, and I'm happy to share that with Professor Odale afterwards with a long list of references. And I think I will also add a publication. So we recently have a publication on co-creation methodology. I will add that as well. So for those of you who are interested in co-creation, so I'll just share one more slide, which is around implication and future work. So the implication here is about, for education, is about embedding inclusivity within curricula. So when you're designing curriculum or you're writing anything, you need to embed inclusivity. For health and education, I think it's important to look at the long-term impact on fostering inclusivity in education and healthcare. So it isn't even just about the immediate benefits that you reap from co-creation. There is a longer-term benefit on all the participants, on all the stakeholders in terms of efficiency, effectiveness, and inclusivity. So that brings my presentation to an end. And so the floor is yours if you have any questions for me. Thank you.
Dr. Dada, over to you.
Thank you very much, Dr. Dairo. I think I would prefer to have virtual claps or hands being clapped. Thank you for the wonderful presentation. I want to, first of all, appreciate you for accepting our invitation, but that will be done later. More appreciations will be done later, rather. So let's have questions. It can be in form of chats, and it can be, if you want to speak, just raise your virtual hand and you'll be admitted.
Can I just say that beyond this session, I'm very open to people reaching out to me. I'm very passionate about co-creation because I think it's the way forward, either in education or in health. I think we're now moving beyond the expert phase where we are listening to everyone and where every voice is equal. So if you, for some of you, if all of this is very new, please feel free to reach out to me beyond this session. I'll be happy to engage with you, but I still want to hear from you this morning.
Okay, well, I gather that from the slides, you will have your address there.
I can add that. It wasn't on it, but no problem. I can definitely add my email address, my LinkedIn.
Okay, somebody just asked, how can we reach out to you? So that's why.
Yeah. Yes, I'll put my email address, and you can reach me via email. You can inbox me on LinkedIn. Yeah.
Okay, thank you. So let me see whether there are chats while we wait for people to raise their hand. But let me check. Let me check first. Let me be sure. No hand for now. Okay, that's a hand up. Habib Olatunde, please go ahead. Habib Olatunde, please unmute and ask your question. Habib, okay, thank you.
Thank you, Dr. Yetunde Dairo, for this wonderful presentation. And it is actually an eye-opening for me because I think yesterday was the first time I'm hearing about co-creation. I'm a clinician in University of Ilorin Teaching Hospital. Okay. So I think this is actually a welcome idea in which all of us can actually incorporate into our clinical practice. Yes. So I think from one of the things that you said is that this the one of the co-creation that you did, it actually took you 5 online presentations or something, yes, or 5 online listening before, yes, and then 1 face-to-face user this thing before you were able to complete the
Yes.
whole process. So from what
Yeah.
I can see is that it is time consuming.
It is.
It is
It
time
is.
consuming. So,
Yes.
and then another thing that I've noticed is that where do we get the resources, especially we are still in Africa, that we don't even have enough resources to do most of our clinical work. We don't have the right tools, the right this thing. So how do we get resources and then the time too? So it's one of the limitations in which I see that can affect the implementation of this in our clinical practice. So how do we intend to solve all this, ma? Thank you very much.
Yeah, no, that's an excellent question and a very valid one for that matter. I think we had 5 online meetings because of the scope of work we did. Sometimes you might be able to do it in 3 meetings and you can map it so that it doesn't take additional time. But for whatever you do, you will need buy-in from your managers, service lead. They will need to provide you with the time. And sometimes you might need additional money. For example, if you're doing co-creation and you're inviting like your patients, for example, to come and participate in what you're doing, you might need money to buy drinks. You might need money to buy refreshments. And so it is possible to do it without all of that, but it helps to have buy-in from your service manager, service lead, whoever is the budget holder. So my challenge to you and to everyone who is listening this morning is that you've heard about co-creation. If this is new to you, you need to go back to your bosses. You need to go back to those who have the levers of power and say, this is what is happening. These are the benefits. It is time consuming, but it's about cost benefit, isn't it? So the time that you put into it, I would argue that is a time worth investing because of what you get out of it. It might be quicker to do it on your own without co-creating, but you have to ask yourself, is it more efficient? And is it more effective? And the evidence suggests that co-creation facilitates efficiency and improve effectiveness. Our time is fast spent. I will not be able to take any more questions. I'm really sorry about that. I'm conscious that this is early in the morning and other people have other things in their diary. I think we started a little bit late. People were late in joining. So I do apologize if I've not been able to get to you, but please put it in the chat and I'll keep my eye on the chat. So if you've got your hands up, put your question in the chat. I'll stay back on to still try and answer question in the chat. So I'm not rushing on. I've got another 20 minutes or so. My next appointment is at 11:30. So I'll be staying on, but I just wanted to bring this, the question session to a close. But to say that I'm reachable, I'll share my presentation with Professor Odole, and you will be able to reach me from there. And who knows, I might be collaborating with some of you in the next months to years. So thank you once again. I'll just hand back over to the host to close the meeting, but I'll stay on. So if you want to stay back to have a chat with me, I'm here to half 11.
Thank you very much. And we're so grateful. Just like Dr. Dairo promised, she will still be reading the charts. Let me hand over to the head of the Department of Physiotherapy, University of Ibadan, Professor Adeshola Siodoli.
Yes, thank you. Thank you, Dr. Olumide Dada, for anchoring this webinar. I'm actually very excited that this webinar got started, and then we'll be closing very shortly. Very, very insightful, stimulating, and interesting webinar. Thank you, Dr. Yetunde Dairo, for accepting to make this presentation on behalf of the Department of Physiotherapy, College of Medicine, University of Ibadan. So I'm just going to be saying, I feel that I should give a little bit of a wrap-up because I've gained some things during the course of this presentation, very insightful and very engaging. the fact that there's no superiority in co-creation. Each stakeholder's voice carries equal weight in terms of power, even though efforts are not the same. That is a take home. That's a take home for me. And the fact that in the methodology, there are so many things you need to agree. When Dr. Dairo was asking that who is a stakeholder, in my mind, I was just thinking, anybody that is in agreement to the aim of delivering a service or getting a project done or getting an outcome out can be a stakeholder. So the agreement in the aim of project, the advertising aspect and definition, the ideation, all of these are very good methodologies or processes that we need to get involved in when we want to do co-creation methodology. The prototyping, did I get that right? Yes. You also mentioned about prototyping and the fact that you have to evaluate, review, and every stakeholder has to finalize on the eventual output. And in all of these processes, we also need to have these stages of empathizing. You know, everybody has to bring something in. There's a kind of resonance, there's a sort of agreement among the co-creators. Then all of the challenges, I thank you so much for identifying the challenges and also helping us out, especially the challenge as to time constraints, getting buy-in. Getting buy-in is also very important. If you do not get the buy-in of your superiors, those who are the decision makers, they may have a lot of problems in co-creation. Thank you so much. Inclusivity, so many things on my mind. Inclusivity, collaboration, open dialogue. And I hope that at the end of today, every single participant on this group, there was a time we had 80 participants. Every single one of us, we are empowered. We are empowered to, or inspired, so to speak. We are empowered, and I hope we are also inspired to go back to our spaces and begin to shout this message of co-creation and the methodology to everyone. Thank you so much for creating time, every single participant. I appreciate every single person, our senior professors, colleagues, students, everybody from the Faculty of Clinical Sciences, professors here, medical, doctors, physicians, students, physiotherapists. I appreciate every one of you. And I'm hopeful that maybe when we have another webinar on this topic or something, you would all avail the department of your time and join us. Thank you so much. Enjoy the rest of the day. As Dr. Dairo just said, she will be available. As soon as we stop recording, she will be available to read the chats and also make inputs where necessary. Thank you so much. I appreciate you all. God bless you.
Thank you.
Before we go, can we all turn on our videos? Let's have a picture. Let's have a virtual picture. Please turn on your videos.
That's a good idea.
Some people have left. Can you turn on the videos? Thank you. I can see Eunice.
That's my mom.
Mommy!
That's my
Mommy,
mom and my
dad. Mommy, you are so much welcome. We appreciate you for joining us, ma. God bless you, ma. So let's have the video. Dr. Dada.
That will take a while because I have
Dr. Dada, please, I don't want you to spotlight.
I have to move from one.
I'll do it from one. I will just, let's remove the spotlight on Dr.
Please go ahead.
Remove the spotlight.
Dr.
Dada, we are seeing you.
We are
just seeing chairs. You know, I'm no longer a host. Otherwise, I would have done it. I'm no longer a co-host.
Okay, let me see.
I can take the picture from my end, but we need to remove the spotlight so that we can have so many people on the screen at the same time.
Everybody.
Can you make me a co-host? Just make me a co-host.
I'm taking one. I'm taking from Dr. Fatudimo to Dr.
Because we are seeing the chair where you are. I hope you are not taking that too.
No,
if you make me a co-host, I'll just take from my end.
So at the moment,
we are going to finish my posting. No, I've been posting for this picture since.
Well, Dr. Dada, just make me a co-host. You are the host. Make me a co-host. Thank you.
I'm taking the pictures.
Okay, that's fine.
So that we can see as many people as possible. At the moment, when we have a spotlight.
Yes, that is the problem. So
if you remove the spotlight, you'll be able to see many. It will fill, so different pictures will fill the screen, which is what we want, isn't it? On my screen now, I can only see Professor Dolly, and we want to see everybody. I want to see, is it Professor Oluwashola? He's ready for the picture. He said.
Dr. Dada, please just pause a little bit and make me a co-host, please.
Light on. If you slide to your left, you will see everybody. I've taken everybody to Tom Akin.
Dr. Dada, please make me a co-host, please.
Okay. Make your ADA. Is that difficult? Make a co-host now.
That was a time I exited and I lost the hosting, whatever. So just make me a co-host.
Big Daddy, good morning, sir. Professor Adegoke.
I'm tired of posting.
Don't let people lose their pose.
Professor Adegoke, well done. Good morning, sir.
Good morning, everybody. How are you?
I'm fine. Let it go for video.
Okay. Okay, now.
Yes, that's more like it.
Oh, you are still, okay, you're not on the spotlight again, but it's still showing us if you're this.
Dr. Dairo.
Okay.
Martin King, sir. Good morning, sir.
Okay, Dr. Dada already took the picture. Okay. Okay, I think we are good to go. Dr. Dada, you just shared your